I think choking was my irrational parent fear. Safe eating is a question we get asked all the time. What do I give my baby? When do I give it? What can my kid have when? We're happy to guide you through those waters. The early on recommendations I have for kids starting solid foods is, age and texture appropriate, comically large, so something they cannot consume, think like whole cucumber, whole apple, or comically small, something that if they did consume, there's no way it would choke them. The biggest takeaways from infant feeding are reheating milk formula, the storage of breast milk and formula. There are certainly guidelines online that can help you know, well, if I heat this bottle up how long do I have to wait to give it? That is really variable for breast milk or formula-based products. So knowing what you're giving and how to give it, I think is hugely important for safe eating early on in life. Heating bottles, trying not to use a microwave. That's not something we see really commonly now, but I'll tell you, I always have a grandparent or a distant relative try to heat a bottle in the microwave. We certainly have that conversation frequently as pediatricians. It really depends on how old your kid is, but lean on your pediatrician, American Academy of Pediatrics resources, and we're of course here to answer any questions you have at your pediatrician's visit if you have them. We get asked all the time, what can I give my baby and when can I give it? The generation gap in this is truly important because what we told my mother is way different than what we tell mothers currently. Typically, for the first 4 months of age, your child will be exclusively breastfed, formula fed, or both. Before 4 months, the only thing your kid is getting is breast milk or formula from a bottle, right? Don't need free water, don't need juice, don't need food items. It's either breast milk or formula. Past 4 months is when that question gets a little bit tougher. We tell parents, if you want to try to start solid foods at 4 months of age, you can, and it's not a chronologic age. It is really a list of milestones, and certainly that can be variable for a child depending on if they were premature, if they're interested in food. So it's not a firm 4 months. We talk about vitamin D and iron sources really early in life, and some of these micronutrients are supplemented in formula that are not present in breast milk. So what we tell you to start with is often dependent on what the kid is getting for their form of milk, right? I think choking was my irrational parent fear. A lot of it is common sense, trying to avoid big chunks, having age and texture appropriate food you're offering. Just be mindful of what your baby or your toddler can bite off and chew and swallow. The big heavy hitting items we always address in pediatrics are hot dogs, whole hot dogs, hot dog chunks. Want to cut those lengthwise and then cut them into comically small bits if you are choosing to do hot dogs. Peanuts, popcorn, tops of lollipops, suckers, grapes. Those are often the other things that we address too as pediatricians. I'll tell you, when I was an infant, they said, don't give your kid peanuts or they'll have a peanut allergy. Don't give your kids shellfish or they'll have a shellfish allergy. That has really been flipped on its head in the past decade. We now know that the earlier kids are introduced to those maybe allergy-forming foods, the less likely they are to have a severe allergy in the future. Now, there's a caveat to that. And I think if you have a strong family history of food allergy, your baby has really severe eczema, or you feel like your kid has the chance to have allergy, that's a conversation you should have with your pediatrician or healthcare provider. But by and large, your child can have those allergy-forming foods early in life as long as they're age and texture appropriate. If you see anything like hives, vomiting, respiratory issues after introducing a food, that's for sure something your pediatrician should be aware of. And if it's emergent, that might be something that needs to be seen and treated more urgently, emergently. But by and large, in my career, I haven't seen lots of horrible food allergies and reactions the first time a kid tries things. So while parents really fear the food allergy, I would preach patience and comfort, because it's not often something we see very early in life. There's an amazing article on healthychildren.org called Starting Solid Foods, and it's one that I often hand out to parents at the 4-month, 6-month visit, because it really does go tick by tick. What should my kid be doing what is important for my kid to try first. Every parent has their own preferences on what they start and when they start it. Your Facebook friend will tell you something different. Your mother-in-law will tell you something different. Your neighbor will tell you something different. So I think at the end of the day, chat with your healthcare provider, your pediatrician. We're happy to guide you through those waters. Picky eating, textural aversions in kids, gosh, it is such a heavy topic because it's something we see almost daily. Most kids are picky to an extent. Most kids have their preferred foods, preferred food textures. With sensory aversions, it can range from, well, I don't like how that tastes and feels, all the way up to, well, my kid only eats macaroni and cheese. Bring those up at your well visits because that is our job, to help parents kind of navigate those waters. Sometimes we'll see kids that parents assume are picky, but in reality, they are eating less and they are needing less because at that period of their life, they're growing less. We as pediatricians always crutch on a child's growth chart, growth trajectory, and picky eating and dietary concerns are treated differently if your kid is gaining great weight. The biggest tip I'll give parents is just care less, okay? Don't freak out. You'll have a kid who skips lunch or dinner. Don't make them another meal if they don't want to eat what you're eating. Most kids are picky with their parents' foods, and we're tempted to make them a Kraft mac and cheese bowl because we know they'll eat that. I would encourage you to know that your child will not waste away if they skip a meal, if they eat like a bird throughout the course of a day. Do not go meal to meal or day to day. Just think about it in chunks, like week to week. Because you'll pull your hair out and go crazy if you're really judging how well your kid is doing meal to meal. And if you feel like you're stringing together some crummy days and weeks, talk to your pediatrician. We're happy to help you guys through that process. You have resources, you have people in your corner, just ask us, we're happy to help. What to do if your kid is choking. I think understanding the signs of choking are really important. Understanding what is a gag and the food coming back up versus what is a choking. And if you're truly choking, you have food stuck in your breathing tube or your windpipe, often you're kind of unable to make noise. The inability to cough is actually a little scarier because it kind of tells us that they are choking to the point where they can't get that food item out. I think every parent should be decently familiar with the Heimlich maneuver. The Heimlich maneuver is something that is different based on age. So the younger your child is, that's often kind of back blows with a child kind of on your knee or on your lap. The Heimlich that we all know and see in movies and TV shows with the arms behind the back. We do that in older kids, adolescents, adults, but knowing like, hey, if my kid were to choke, which of these maneuvers am I supposed to be doing, and how do I do them? And then again, if this maneuver is not working, what do I do? We also see lots of products that are kind of marketed to remove items from a kid's throat. I don't know a ton about those, but I see parents carry them in their diaper bag and know that they have utility. I would say just understand the basics of the Heimlich maneuver and when to do it and how to do it on your kid. I think that's probably where I'd point you. Most children will self-regulate. It'll be okay. If they skip a meal, if you feel like they're not eating, that you feel like they're drinking less than they need, most kids will eat when they're hungry and drink when they're thirsty. So try to take stress and anxiety out of the equation if you can. Your kid will be okay. If you feel that eating is a problem, discuss it with us as your healthcare provider, pediatrician, so we can review growth charts and growth trajectory, but try to care less. Remove the stress and anxiety that comes with feeding, and I think that you and your family unit will be happier because of it. But it'll be okay. We all struggle with feeding, picky eating, when to give what we want to give. But just know that, our parents made it. You'll make it too. It'll be okay.